Procedure for proper giving and removing bedpan. Decide how much assistance the patient currently needs. Check the patient's activity order and physical status to determine whether a bedpan is necessary. For skills and attitude, assemble equipments in order of their use. Wash your hands and put on clean gloves to protect both the patient and you. Use the principle of infection control throughout. Explain the procedure to the patient. Close the door and screen the patient. Rationale to provide privacy. Raise the bed on the high position. Put up the sidewell on the opposite side of the bed where you plan to stand. Rationale to provide safety to the patient and convenience for the caregiver. Take the bedpan. Cover the toilet tissue out of the bedside storage unit. Put the patient on the bedpan using one of the following methods, depending on the patient's condition and ability to assist you. First, with the patient in a recumbent position and your hand under the small musical area of the back for support, ask the patient to raise the buttocks by raising up the feet as we push the pan into position under the patient. Second, ask the patient who is able to assume the sitting position to lift the body by pushing down with the hands and feet as you place the pan in position. Third, roll a more immobilized patient into the pan. For this maneuver, elicit the patient's cooperation. Ask the patient to hold the side rail on the opposite side of the bed, across from where you are standing. For stability, as you roll the patient away from you in one place the pan against the patient in position. You may want to pad the pan with a towel to relieve pressure on the patient's buttocks. Now, hold the pan firmly in place as you roll the patient's back. Finally, check the position of the pan. If the patient must remain flat, you may want to place a small pillow above the bedpan under the patient for support. Note, if the patient's bed has trapezy, make use of this device for placing and removing bedpan. Have the patient feel the trapezy to lift the hips. Elevate the head of the bed to mid or high rollers position. If this is not contraindicated, ask the patients hold the side rails. Rationale. Provide position that approximate what is normal for the elimination. Place the toilet tissue and cowbell within the patient's reach. Leave the patient. Rationale. Emphasize privacy during elimination removing bedpan. When the patient signals, return promptly. Put on clean gloves for infection control. If necessary, clean the genital area with toilet tissue from anterior urinary region to posterior region rectal. Rationale. Minimize the chance of contaminating the urinary tract with fecal microorganisms. Remove the bedpan. Cover the bedpan. Carry the pan into the bathroom. Collect a specimen. Measure the urine. Note for amount, color, consistency, and odor. Empty the content into the toilet and flush. Thoroughly clean bedpan with cold water or any disinfectant solution with a long-handled brush. Wash and rinse. Use paper towel for drying the returned bedpan in patient storage. Remove and dispose gloves. Give the patient basin of warm water. Wash the cloth and towel or moist towelette so that hygiene can be carried out. Place the bed back into low position for safety. Dispose equipment. Wash your hands. Note efficiency of the technique used and how suitable for the patient. Document the procedure. Procedure for properly assisting elderly on tap bath. For skills and attitude, prepare all the necessary equipment. Assemble equipment like washcloths, pants, soap within reach. Make sure the tub is clean. Rationale, maintain cleanliness and safety for the clients. Place a rubber mat at the bottom of the tub. Place bath mat or any disposable absorbent material in front of the chair or near the tub. Place bath blanket at the back of the chair to cover the patient after bath. Extra towel for drying hair of the patient. Assist client to sitting position on the side of the bed. Assess readiness of the patient and explain the procedure. Be sure that the patient is allowed to take the tub bath. If in doubt, check the patient's chart in the nursery station. Help the patient if needed to finish dressing in the bathrobe and offer sleeper. Accompany or transport patient to the bathroom. Bathing will be tiring. Transportation in a chair will conserve energy. Hang in, occupied, or in use sign. Rationale, clients need privacy while bathing. Explain or instruct precautions for safety. Fill bathtub with warm water from 100 to 115 degree Fahrenheit or 37.7 to 40.6 degrees Celsius. Keep client covered until tub is ready. Let the client check water temperature. Keep the client warm to prevent chills. Help client into the tub providing necessary assistance. Rationale, falls can occur. Provide safety. Prolonged exposure to warm water may cause vasodilation and pooling of blood, which can result to lightheadedness or dizziness. Leave the patient alone during bath. Do not leave the vicinity of the bathroom. Check on the client within the 10 to 15 minutes. Be alert for any silence. If bath is completed, instruct the patient to pull the drain plug. Take bath blanket on the chair to cover his body. Provide necessary assistance in taking the client out of the tub and sitting on the chair. Draining water and assisting the client getting out of the tub help prevent falls. Assist client with dressing and grooming. Return to the bathroom. Clean the tub. Discard soiled linen. Place an occupied sign on the door. Maintain cleanliness and good infection control practices. Wash your hands, record and report. Procedure for proper assisting elderly on shower bath. For skills and attitude, prepare all the equipment and supplies. For preparation for the shower stall, test faucet function. Place the rubber mat on the shower floor and stool over the rubber mat. Place chair and bath mat outside the shower stall. Place bath blanket covering of the patient after shower. Assist patient to sitting position on the side of the bed. Assess the readiness of the patient and explain the procedure. Assist in standing. Accompany or transport clients to the bathroom using wheelchair and offer sleepers. Showering or bathing will be tiring. Transportation in a wheelchair will conserve energy and accompany the client to avoid sleeping. Hang occupied or in use sign. Clients needs privacy while bathing, but shower door should not be locked so that the caregiver can go calm to assist client as necessary. Explain and instruct precautions for safety. Testing temperature before entering prevents burn and scalding. Help the client into the shower room and sit on the chair providing necessary assistance. Falls can occur. Provide safety for the client. Sitting on the chair will prevent fatigue. If the client is showering independently, check on the client within 10 to 15 minutes. Stay close to the shower opening. Prolonged exposure to warm water may cause vasodilation and pooling of blood, which can result to lightheadedness or dizziness. If the patient is unable to shower independently, always stay with the client. Use handheld shower. Handheld shower allows caregiver to stay dry. Help client out of the shower. Turn off shower. Offer bath blanket to cover himself. Assisting client helps prevent fails. Ask patient to sit on the chair outside the shower room. Assist client in drying, dressing, and grooming. Return articles to proper places. Maintain cleanliness and good infection control practices. Return to the shower room according to agency policy. Discard soiled linen. Place an occupied sign outside the door. Wash your hands. Record and report. Procedure for properly assisting patient who is able to brush teeth. For skills and attitude, prepare necessary equipment and supplies. Place articles or supplies on the overbed table. Raise head of the bed to place patient in sitting position if this is allowed. This position will prevent aspiration. If patient cannot sit up, he may be able to wash his teeth anyway. Turn such patient on his left side if he is right-handed and supply him with articles needed. Protect patient's gown and bed with towel. Do not soil patient's gown and bedding, for this will add discomfort to the patient. Give the patient an opportunity as often as time permits to wash his teeth after he eats. Do not deprive the patient of caring for himself. Also, do not let the patient rely on caregiver. Give assistance if he needs, but do not perform all the procedures for him unless he really cannot do it. Assist patient as necessary. Offer help to rinse mouth. If help is not needed, leave him alone. Remove articles for cleaning when patient is finished. Rinse toothbrush under running water. Clean other articles and return to patient's bedside cabinet. Discard disposables. Do the aftercare. Remove gloves and hand wash. Record and report. Procedure for properly assisting the nurse with proper preparation and administration of oral medication. Assist medication nurse in the unit in transcribing confirmed doctor's order to individual patient cards. Preparation and transcribing of Medicard as per institution standard frequency. Color coding per patient based off the cards. Arrange medication card in a tray to avoid misplacement. Properly check the label of the medicine and properly confirm the following from the medication card: the name of the drug, name of the patient in the drug label coincide with the medication card, proper dose of drug, expiration date, frequency of drug to be administered. For preparation of tablets, pills, and capsules, read the label. Remove the cap and gently shake the prescribed number of the tablets or capsules. Place in the medicine glass and return the bottle to the shelf. Place the medicine glass with tablet and capsule at the top medication card for specific patients. For preparation of liquid medicine, read the label, shake the bottle. Open the cap and pour the medicine along the unlabeled side of the bottle to the medicine glass at the eye level. Rationale, to keep the bottle from getting stained with medicine. Wipe the rim of the bottle with a clean piece of cloth or tissue and replace the cap at once. Then, return the stock bottle to the shelf. Put the medicine glass with the medicine on the top of the medication card. After properly preparing the medication and reconfirming the content of the medication card accordingly, proceed in assisting the medication nurse in administration under his or her supervision as per institutional policy. Properly identify the patient based from the medication card and state your objectives. Aftercare of the equipment used, putting the medicine card in its proper place as well as the medicine glass. Leave the patient comfortable. Do the hand washing before and after the procedure, then document the procedure when done. Procedure for proper collection of stool specimen. After confirming doctor's order, explain to the patient the needs of stool specimen for analysis. Instruct patient on how to obtain stool specimen. Prepare all materials equipment needed. Wear gloves. Offer bedpan for bedridden patient. Use a spatula to obtain stool specimen. Close the specimen bottle tightly. Discard remaining stool in the toilet bowl. Clean and dry the bedpan. Remove gloves, wash your hands, document procedure. Send label specimen to laboratory with properly filled up laboratory request form. Procedure for proper offering and removing urinals and collection of urine specimen. Prepare all the necessary equipment. Proper identification. Explain that urine specimen is needed upon patient's call to void. Wash your hands and wear gloves and respond promptly with all the equipment needed. Offer clean bedpan or urinal. Emphasize how to collect midstream urine. For ambulatory patients, instruct them on how to obtain specimen. For non-ambulatory, assist the patient using urinal or bedpan. Carry the bedpan or urinal to the bathroom to transfer the specimen from bedpan or urinal to specimen bathroom, filling 2/3 of the sterile container. Close cap tightly. Measure the remaining urine for intake and output monitoring. Discard remaining urine in the toilet bowl. Clean and dry bedpan or urinal and put it in on a designated place. Send the specimen to laboratory with laboratory request form completely filled up with information. Procedure for proper collection of culture specimens. For the female, clean the outer urinary meters of the patient with the antiseptic solution. Don't sterile gloves. Place non-dominant hand on the labia minora and gently spread to expose urinary meatus. Visualize exact location of the meatus. Using sterile hand, heat up antiseptic solution, saturated cotton ball with a sterile forceps. Cleanse the urinary meatus with one downward stroke. Discard. Repeat this step 3 times. Use forceps and dry sterile cotton balls to absorb excess antiseptic solution. Then assist patient in voiding. For male, wear gloves with your dominant hand. Hold the penis at a 90-degree angle to the body. If the patient is not circumcised, pull back the foreskin with this hand to visualize the urethra of meatus. Using pickup forceps, cleanse the urinary meatus with one stroke downward from the meatus to the base of the penis. Discard. Repeat 3 times. Dry with the sterile cotton balls. Assist patient to void. Do the ungloving, wash your hands, record and report. Procedure for properly assisting elderly and changing clothes. Prepare necessary materials and supplies. Rationale for smooth carrying out of the procedure. Bring clean hospital gown to bedside. Do hand washing and wear gloves. Rationale, to prevent the spread of microorganisms. Raise patient's shoulder from the bed as much as needed. Relocate the tie snaps at the back of the patient's neck and unfasten the gown. Take gown sleeves off arms but leave it across his or her chest for the time being. Rationale, drape the patient appropriately to prevent unnecessary exposure of his body. Place clean gown over and slightly lower than the used one. If the patient has disabled arm, place the sleeve on that arm first. Sometimes, patients speak of their bad arm, which may only mean that it is stiffer than the other. Consider it as disabled. Put the sleeves by placing your hand through the clean gown sleeves and gather it up. Then, still holding it so, gently grasp the patient's hand or wrist. Still holding the gathered sleeve, use the other hand to pull sleeve into position. It is not necessary for the patient to fumble and poke here and there, trying to find the armhole. Repeat this step with other sleeve. Holding the clean gown by collar at the patient's chin, slip the other hand underneath the clean gown and pull the used gown off the patient. Look for personal items, which may be pinned to the gown. Then, fold the used gown and place it on the laundry hamper. Give particular attention to look for these articles. They might be cheap or common items but very valued to the patient. Do the aftercare. Remove gloves and hand wash. Record and report.